Following amendment, Secretary will read the amendment.
Floor amendment number 1 by Johnson.
Senator Johnson.
Thank you, Mr. President. Members, this amendment to Senator Kolkhorst's bill would assist the Health and Human Services Commission in carrying out its functions. Senator Kolkhorst's bill contains a great deal of important material that we ought to support. In addition, this is the last chance of this legislature to influence the direction of health care apart from what might happen outside of our control. We've all been quite frustrated over the past year at the lack of input of the legislature in how federal funds are allocated. This amendment I offer in response to recent events. In January of this year, Governor Abbott negotiated with then President Donald Trump to bring to Texas a non-expansion Section 1115 waiver, a whole lot of money to cover uncompensated care. Recently, the Center for Medicaid and Medicare Services in Washington under the Biden administration has rescinded the approval of that non-expansion 1115 waiver, which means that Health and Human Services, the agency, and Governor Abbott will be going back to Washington to renegotiate the federal funding that our Medicaid system receives in Texas for, among other things, uncompensated care. But we can expect that it won't be the same as what we got before. So we're going to need some other ways to take care of the uninsured in this state. What this bill does, this is not Senate Bill 117. This is not the Live Well Texas plan that all of you know about because I've talked to all of you about it. This is much simpler, much more deferential to the agency, to the governor. It simply is a directive to the agency to seek, through an 1115 waiver, a maximum drawdown of federal dollars to fund the state-administered, not a federally administered, but the state-administered Medicaid program in these specific ways. We want to reduce the number of uninsured residents in the state. Importantly, directs the agency to seek an 1115 waiver that will promote personal responsibility with respect to health care and the consumption of health care, that will increase the efficiency, as Senator Kolkhorst is doing in other parts of this bill, that will increase the efficiency of the delivery of the health care services, increase accessibility, as Senator Kolkhorst is also doing with her bill, and overall reduce health care costs. So, members, we are looking at a big fiscal calculation right here. In addition to the rescission that has put us in the position of not having federal funding that we previously thought we were going to have, the American Rescue Plan has offered states that adopt this kind of federal drawdown under the Affordable Care Act a 5% FMAP bump to our existing Medicaid population that would result, it is calculated from Washington, in $3.9 billion additional dollars being funded to Texas under the Medicaid program, 7/8 of which would come to us in the next budget cycle. That's $3.5 billion coming into our state without the creation of a tax, in addition to the federal dollars, our own tax dollars, that we would be drawing down in the tens of billions over time. So, by adding this amendment, we add $3.5 billion in a single biennium. We don't impose a tax on anybody. We create jobs, and we improve the efficiency of our healthcare system, family stability, all those things. We try to do self-sufficiency through our Medicaid program. So I offer this amendment to Senator Kolkhorst's fine bill that attempts to and purports to make our Medicaid system more effective for our impoverished Texans, helping them become part of our economy. And this takes it a giant leap forward with about another $3.5 billion in net revenue to the state, plus all the dynamic revenue that it brings. So, members, this is our last chance to have some influence over what happens with our Medicaid program. This summer, Governor Abbott will have to go to Washington and seek funding through some mechanism. This is our way to give some guidance to the agency, to leadership, about how that money ought to be spent. And I know that every one of you thinks that it ought to encourage personal responsibility, that it ought to bring costs down, that it ought to increase efficiency. And we want to put that in statute. And so, members, I urge you to adopt this amendment.
Senator Kolkhorst.
Thank you, Mr. President. Thank you, Senator Johnson. I know you're passionate on this particular issue. You and I have had many conversations. You are correct about some of the historic steps that have been taken in the last month with a waiver that had been approved that has now been disapproved. We think it's the first time in the history of our nation that has happened. And so with this particular amendment, what you're doing is you're actually expanding eligibility for Medicaid to the 138 population of FPL and below. The spirit of committee substitute to Senate Bill 2028 is looking at how we serve those that already qualify for Medicaid. And right now on the wait list for some of our waiver slots, those are, home and community-based care, HCS slots, MDCP slots. We have so many of those. We have a wait list of people that actually qualify for Medicaid right now of 168,000 people that are the most fragile among us, that I'm working through conference with my counterpart, Representative Priglione, and trying to put more money into those so that we can reduce that wait list. And so I'm going to respectfully oppose this amendment to focus on those that already qualify for Medicaid and making sure that we invest in those absolute most fragile in our society that qualify. And I will also say that when we look at those that are uninsured in our state, and I've looked at a lot of that different population, Medicaid expansion does not qualify a lot of those. And we have, of the number, 51% actually could qualify to go into the exchange. And we're doing things to try to help people realize that, because, of course, it's a part of the ACA that we have the premium benefits. And so we could reduce those that are uninsured in the state of Texas by the current programs that we have offered. And so with great respect, I oppose your amendment, and I look forward to working with you in the future.
Senator Lucio, what purpose?
I'd like to ask a question of the author of the amendment, if I could. A question.
Senator Johnson?
Yes, I yield.
Senator Johnson, thank you for your amendment. I'm sitting here and I'm just wondering how many people out there in Texas could be eligible to receive some kind of help, medical help, healthcare delivery from the funds that you are talking about us being able to bring down through this amendment, asking Washington, obviously, to give us their ultimate support in addressing the shortcomings that we have, actually been involved with in trying to reach as many people as we can. There's so many out there. Do you have any figures that you could share with us from the agency itself on how many people could qualify for Medicaid that aren't qualified, and why aren't they qualified if they are qualified?
Senator Lucio, very important questions. Thank you. Under the amendment as it's structured, directing a maximum drawdown, the maximum drawdown would relate to a population, as Senator Kolkhorst said, up to 138% of the federal poverty level. That would make around 1.5 million Texans, kind of depending on how we bounce back from COVID. It could be more, could be a little less, but around 1.5 million Texans would qualify for coverage at a 90-10 reimbursement rate from the federal government if we were to proceed with this. The assumed take-up rate in Texas, it varies depending on who you ask. It could be anywhere from 75% of that population on down to maybe 54% of the population. Most estimates that we've received, whether it's from agencies, past studies, or outside groups, hover somewhere between 700,000 and 1 million, and 700,000 and 1 million people that could gain coverage through this.
Well, I was a public school teacher before I got into the political arena, and obviously I'm nowhere close to being a doctor, but I figure if you don't address an illness, you become sicker. You become more sick, and sometimes it ends up being catastrophic and people die, unfortunately, because they're not given the attention they need. And don't you agree with me that no one should have to die just because they can't afford to live?
Senator Lucio, absolutely right. And there are figures on that. There are estimates that we may see as many as 2,000 people a year dying because we don't have health coverage where we could provide them health coverage. But you raised another very important point that directly to the amendment and even to the spirit of Senator Colcourt's bill here in terms of cost efficiency. You mentioned that people without health care might have a mild health condition that becomes acute because they don't go get coverage, they don't seek care, and they end up being sicker, possibly die, but if they recover, it also ends up being more expensive to the state. So we're talking both about the social consequences of people not getting care and the fiscal consequences of people not getting care.
Well, yesterday was Mother's Day, and some children didn't have their mother with them to celebrate Mother's Day. And it pains me to know that we could do a little bit more for the people of our state, especially, and I have to obviously pinpoint my district, which is high in poverty, but high in love, for those that need assistance, especially when it comes to health care. That's the number one issue in my community, by far. Everything else is a second.
And Senator Lucio, you've shown throughout your legislative career your commitment to bringing health to the people of your district and of the state, and I, for one, admire it and appreciate it.
Well, I just urge the members to do as much as they can during this budgetary process, during the period of time we have left on this floor, to truly address the needs not only of your home district, but your neighbor. Let's be a good neighbor. Thank you.
Thank you, Senator Lucio.
Senator Gutierrez, what purpose?
Will the gentleman yield for a few questions? Mr.
Senator
President?
Johnson,
Yes, I will. Thank you.
you're recognized.
Thank you, Mr. President. Senator Johnson, thank you for your time and for this very thoughtful amendment. I wanted to ask you, because oftentimes we sit up here and we wax, poetically, and we get into statistics and so on. You mentioned a percentage earlier. When I try to tell people at home about Medicaid expansion, I tell them, look, there's already Medicaid for people that are living at poverty level. This is actually for working Texans. And so when you said, I think 138%, was that the number you suggested?
Yes.
And a family of four at the poverty level is at about $26,000. Is that accurate?
That's my memory.
So essentially, for a family of four that's making, and my math isn't great, so I had to use my calculator, about $37,000, a little shy of that, $36,600, something like that. That's who we're talking about giving health care coverage to, working class Texans.
That's right. By definition, if they're making $36,000, they're working.
Yeah, and they're working, and it's hard, and they're raising four children, and sometimes health care just isn't available, and then having to go out and pay these horrible insurance coverages, it just makes it very cost prohibitive when insurance is costing you, $4,000, $5,000, $6,000 a year to insure your family. And now the same family of four is down to $29,000 or $30,000. And so I think that it's important, you would agree with me that it's important to talk about, hard numbers about what we're talking about. Sometimes we get lost in the percentages. We're talking about working class Texans. Isn't that right?
We absolutely are.
All right. Thank you, Senator Johnson.
Thank you, Senator
you have a very good amendment.
I appreciate the emphasis on that point.
Question is on the adoption of the amendment. Secretary will call the roll.
Alvarado, Betancourt, Birdwell, Blanco.
13 ayes, 17 nays. The amendment fails. Senator Colcourt, you're recognized. Passage to engrossment.
Thank you, Mr. President. So moved.
Secretary will call the roll.
Alvarado, Bettencourt, Birdwell, Blanco, Buckingham.
30 ayes, no nays. The bill passes to engrossment. You're recognized to suspend the constitutional 3-day rule.
So moved, Mr. President.
Secretary will call the roll.
Alvarado, Bettencourt,
30 ayes, no nays. Rules suspended. Chair lays out third reading final passage. Committee substitute for Senate Bill 2028. Secretary will read the caption.
Committee substitute, Senate Bill 2028, relating the Medicaid program.